So during today's press conference, we're about to brief you the latest development of COVID-19 in the province and also our application of traditional Chinese medicine in the treatment of the patients, as well as the guidance to our home-based quarantine personnel present with us. Mr. Zhang Xiaofeng, DG of the Provincial Administration of Traditional Chinese Medicine. Mr. Liu Yancheng, Level 2 Counselor. Mr. An Ganghui, Director of the Discipline of Psychological Medicine, and also Mr. Guo Jianming from the Suihua Health Committee, and they will give us the briefings and also take the questions. First of all, I'd like to give the floor to Mr. Liu Yancheng, Level 2 Counselor from the Municipal Health Committee. Friends of the media, good morning. First of all, the latest development of COVID-19 prevention and control. As of 22nd January from 0 to 24 o'clock, we have newly reported 56 confirmed cases, among which in Wangshui County 40 cases, Harbin Liming Development Zone 7 new cases, in Suihua Heilongjiang City 6 cases, Anda City 1 case. And we also have 29 asymptomatic cases transformed into the confirmed cases. Suihua Heilongjiang 6 cases termed from asymptomatic cases. Liming Development Zone 2 asymptomatic cases developed into confirmed cases. We have newly reported 27 asymptomatic cases, among which 22 in Wangshui County, 8 in Heilongjiang, 1 in Suiling, 1 in Anda, 1 in Hulan, and also 4 in Liming Development Zone. There are no new death cases. Starting by the outbreak of the cases in our province in Suihua City, until now we have in total reported confirmed cases of 359. In total, 14 cases from Liming Development Zone, 10 in Heilongjiang City, 8 in Anda, Beilun District 7 cases, Firefighting Zone 7 cases, Hulan District 5 cases, Zaoliqu 1 case, Qiqihar City 1 case, Daqing City 1 case, and Daqing Zhaozhou 1 case. Asymptomatic cases in total 459, among which 259 from Wanghui, 44 from Liming, 27 from Harbin Hulan, 25 from Qiqihar, Suihua Heilongjiang 22, Suihua Anda 15, Suihua Suiling 8, Qiqihar Flower District 7, Suihua Beilin 4 cases, Suihua Qinggang County 3 cases, Nanwang 3 cases from Harbin City, Dajingshan County 2, Dawai District 1, and Sartu District 1 case. Second, to well apply the preliminary prevention in the rural areas after entrance into the winter season with this outbreak, we have noticed that in the countryside, people have lowered down their guards, so it means more difficulty in the prevention and control. This is the first barrier against the further spreading of the COVID-19. So we have to follow the 4 tips. First of all is to prevent excessive flow of the people during the Spring Festival season. If not necessary, people should not move around and visit each other. And we should also take more care about the people in the key areas, for example, for the food distribution and stock. If not necessary, they should stay in their current permanent residence for the Spring Festival. And for all the localities, if not necessary, they should not organize any artistic performances or promotion events. And if necessary, we should also control the total quantity of the population and also to reduce the frequencies. We have to follow all the guidance in place to carry out our prevention and measures. And for the residents, they should also avoid any excessive gathering. For the rural residents, they are encouraged to stay at home and also to postpone the unnecessary activities and also to streamline the process for the necessary events like the funerals. For people traveling back to the countryside, they should hold a negative result of the nucleic acid test report. And they should also stay at home for 7 days. That's a home-based quarantine. And every 7 days, they should receive another round of nucleic acid test. And for the neighborhood committee, they should also shoulder the responsibility, for example, put the network-based supervision mechanism in place and also keep a close eye on those visitors coming to this area. And fourth is to continue with our education campaign. With multiple channels, we should spread more knowledge to the people in our region and ask everyone to respect the rules and regulations. If people come from other places to our region, they should follow the procedure and the routine for the checks and also the supervision. They should wear the mask and also wash their hands regularly. If they have developed burning throat and fever or any other symptoms, they should report to the authority immediately and go to the closest hospital. Thank you very much for Mr. Liu. Now is the Q&A session. The floor is open for your question, and before giving the question, please first identify yourself. The first question, please. I'm from a CCTV. As we know that in Suihua City you have carried out a lot of nucleic acid tests. We know that a lot of medics are on the spot for the tests, so they are in need of the masks and other protective gowns and also medical supplies. So currently, what is the stockage? What is the amount available for all those medical supplies? I'd like to give the floor to the Suihua Health Committee, Mr. Guo Jianming. We have applied multiple measures to guarantee the supply of all kinds of medical necessities. Currently, we have obstacle-free channels for the supply and production of all the medical supplies, so we can assure 100% of the demand from the medics. We have following measures in place. First of all, to strengthen our purchasing. The Municipal Financial Administration has allocated a special fund for the purchasing of the materials. According to the announcement of the provincial authority, we have set up an obstacle-free channel for the purchasing of the high quality and good prices of those medical supplies. We have also established multiple channels of contacts with the producers of those medical supplies to ensure that we can receive the high-quality supplies at due date. And we also create a platform to allow the users and also producers to interact one with another. So in total, we are making a synergy to ensure the quality of the manufacturing. For the suppliers and the manufacturers to offer the products, first of all, they have to hand on their certificates and qualifications to show us that they are qualified for the manufacturing of these requested materials. If we cannot get enough supply from certain channels, then we also have extra sources of supply. Judging by the current stock, I'm sure that there's no shortage of the supply in the market and for the medics. Second question, please. Thank you. I'm from Hong Kong Commercial Daily. We know that during last year's COVID-19 prevention and control, traditional Chinese medicine, the TCM, has played a very important role. So this time, during the outbreak, what is your work in using the TCM in the treatment of the patients? I'd like to give the floor to Mr. Zhang Xiaofeng, the DG from the TCM administration. Last year, we have had a national outbreak of the COVID-19, and we didn't have the vaccine last year, so the TCM has played a very important role in the treatment of our patients. We have used the TCM in multiple manners to accompany the treatment based on the Western medicine, and altogether the two types of medicines have helped to prevent the further spread of the COVID in the population, especially for the asymptomatic cases and also the light patients, the light confirmed cases. We have brought TCM into full use, and also for the people in quarantine status, TCM has also the special role to play. Because we know that TCM is aimed at the prevention of the coming diseases. So for the TCM, we are targeting at the root causes. So today for the light cases and also for the people in quarantine, we are applying the TCM, and we are bringing into full play the strength and advantages of the TCM for the recovery and restoration of the patients, for patients that have turned from the positive to negative results of the nucleic acid test. We have also encourage them to practice according to the Baduanjing, a traditional Chinese sport. So this has shortened their waiting period before the total recovery. So this is also the wisdom of the TCM. And also based on the characteristics of our region, of our province, we have developed 3 versions of the treatment and 1 version of prevention method. We also have the TCM soup for the prevention of the disease. And also in our province, we are one of the 4 earliest provinces in using the 清肺排毒 soup, a traditional Chinese medicine-based herbal soup. At the same time, we are also following the guidance of the National Health Commission in carrying out our actions. We are also in communication with the Russian experts. Last year, in all the treatment cases, we have applied in more than 95 cases the TCM. And this year, first of all, we have put in place an expert team right after the outbreak in the province. And compared to last year's expert team, this year, in different places of outbreak, we have put in place 13 expert teams, so 1 expert team for each place. So for the provincial level, we have these many expert teams, and also at the local levels, for example, municipal level and county level, we also have their separate expert teams. So this means we are fully prepared. And secondly, after the outbreak, we have already dispatched the 5 expert teams. They reached relevant counties and municipalities to work with the local experts. Altogether, they elaborated the treatment plans and also the medicine plannings for our patients. Our TCM experts, they are very close to the patients, so they could carry out an observation at close distance to our patients. And this time, for some patients that are turned from positive to negative results of the nucleic acid test, we are also using the TCM for further intervention to build up their body strength and also to shorten the waiting periods before the total recovery. And for the healthy people, we are reaching to them through our WeChat channel to give them TCM-related knowledge and also take their questions, give them psychological consultations, especially for people currently in the quarantine. We give them some mental education. As of yesterday, the participation of TCM in the confirmed cases reached 100%. And for the asymptomatic cases, the ratio of participation of TCM reached also 97.26%. So this shows that TCM has a really active role to play in the treatment of cases in our province. And thirdly, for the people in quarantine, in multiple cities and counties, for the close contacts of the COVID-19 confirmed cases, we have also delivered the TCM soup to them. And for the national team experts, they have also studied the Liaoning, Jilin provinces and also Dalian cities cases to propose a prevention soup prescription to our experts in the province. According to the guidelines of the national authority, we are delivering this prescription to the population. After the proposal of the prescription, we should use this version of the prescription in a very targeted and also adaptive manner. We should first look at our patients to see whether this prescription is suitable for them. And today, the average participation rate of the TCM in the cases reached 94%. And this time for our expert team, because we have the one-to-one education and communication method, after the communication with the national teams, we have already organized a seminar of training with 174 participants of medics. And this evening, we're about to set up a further communication between the provincial level experts with the national level experts. And moving forward, our administration of the TCM management, we have 5 division directors moving down the ladder to reach to the grassroots, to the primary level, so that they can inspect the application of TCM in different hospitals. For example, in the emergency departments and also for the contamination inside the hospitals, we should make more efforts in the site to prevent any possible outbreak of inside hospital contamination. At the same time, we will also strengthen our supervision on the application of TCM according to the guidance of the upper authority. So this time, the TCM would play a bigger role and be more useful to our people. Thank you. Thank you very much, Mr. Zhang Xiaofeng, for your briefing. And the third question, please. Thank you. I'm from China News. This time, after the new round of outbreak, the residents, they are put under the quarantine. So I have a question for our experts. What are the measures to accompany those patients or the people in quarantine, and how could we assist them from a psychological way? To Mr. An Ganghui, expert of psychological consultation. First of all, we'd like to say thank you to all the medics that have stuck to their position. And for people now under quarantine, they may suffer from some disturbances, especially for our people in the medical concentrated quarantine. They may feel anxiety and also fear because in that concentrated area of the quarantine, it's quite easy for them to get contaminated, and they're also worried for their family members. After long hours of waiting in this isolated environment, they may feel really uncomfortable and they will feel very anxious about the status. But first of all, we encourage them to express their feelings. We are all human beings. So in face of those challenges and also unknown things, it's quite normal for us to develop some anxiety or fear. Some people will feel the headache and some people will feel breathing difficulties. So for different people with different symptoms, they have to develop their own system of soothing themselves. Some tips for you. First of all, you have to take a very good sleep, and during the daytime, you have to be really active and don't sleep too much during the day. So you should have a routine-based, a very regular routine of the whole day. You can set up your timetable when you should call your family members, when you should get up, when you should go for some physical exercises, when you should go stretching your body, when you should go for some more active exercises, some challenging sports, and when you should take deep breathing and go to bed. And also during the quarantine period, you can take this moment as a relaxing moment and also a period for self-development. You should not consider this period of quarantine as a torture, because the more you become impatient, the longer the days would seem. And you could try to find some sports that you can involve the whole family, so all the family members could carry out the exercise together. This will also enhance the emotional ties among you. And for the chores every day, you could separate your tasks so everyone has a part to play. And in winter times, you know that in the northern part of China, we don't have enough sunshine, especially in our province. So when you receive not enough sunshine, it's important for you to add up some vitamin D. And you also have to train your breathing rhythm in order to relax the whole body and also to relax your muscles. Like that is easier for you to get out of that anxious status. For everybody, according to your personal characteristics, you can find a way to relax yourselves. For people that is a fan of the reading, you can finally have long hours of reading. For people that are good at the handcraft, you can do some craftsmanship works, and also for people, the lovers of the sports, you can do some sports, you can do yoga, and also the 八段锦. For people that are very good at video shooting, you can upload your work telling the story of your recent days on the quarantine on the internet to share your stories with the others. For many people, you're blocked in the province. You cannot go back to your hometown to celebrate the Spring Festival with your family members. But it's very important for us not to forget the rituals during the Spring Festival. For example, you can restore family members through online channels. You can sing together and dance together with your family members, because today the technology is so well developed. So there are many options for you to get connected with your family members and also enjoy your life. Thank you very much for our professor, for our Dr. An, and also thank you very much, our friends of the media. Thank you very much for your attention and your questions. Later on, our transcript will be also updated to the website. Tomorrow, there will be another press conference waiting for you. This is our regular press conference. So for today, it's the end of the press conference. Thank you.